There's a profound connection between identity and healthcare. And at the core of this connection is, of course, privacy. However, there are also a broad range of needs for access to your medical information by those who need it. And balancing these needs is the key step to moving forward in the healthcare context.
One of the things that my organization is working on is the idea of electronic consent management, because you need to be able to give people control over how and when their healthcare information gets shared. And people should be given the power, especially when you think about sharing medical information with, for instance, wellness people, where you wouldn't want them to know every single detail of your medical history. There needs to be some electronic system for embodying a patient's preferences as to what information they would like to share with whom and under what circumstances. So my organization is working on a thing called the Consent Management Project, and what we're trying to do is to map the business processes in healthcare of how consent information gets collected, stored, acted upon, and transmitted to other organizations. And once we've mapped those processes, try to, number one, see if there's a way to harmonize the business practices, but then to see if we can automate those practices and bring technology to bear in a way that can make consent information meaningful again.
Right now, consent is largely an on-off binary affair. You can consent fully or not consent. What will be needed in the information age is going to be more nuanced methods for consent so that we have more of a spectrum, where on one side information remains private as it should, and depending on the circumstances, the need to know, the roles of the people that you may want to know under certain emergencies, for example, you can have a broader and broader range of access that's been consented to in advance. One of the most interesting changes that I believe we're going to see in the future will be in that part of healthcare that we loosely term now wellness. In other words, that cluster of activities that address people's mindset, their exercise, nutrition, and other factors that help with the prevention of illness and the maintenance and enhancement of how healthy and happy and whole we feel. In the wellness sector, I think we can see very soon now an introduction of a wide array of new types of services and new kinds of products that will be available. But at the middle of all of it, yet again, is identity.
I mean, I think the beauty of wellness is that it's multifaceted and that it involves not just physical activity, but things like meditation and nutrition and, just, thinking the right way about, yourself and, sort of your life and your, prospects for happiness. And those are information-intensive undertakings. And so it just makes sense that information technology could have an important contribution to improving that.
And then there are a whole set of issues that may be even more important about software and digital technologies that help you to manage wellness, help you to keep track of your diet, help you to keep track of your exercise, intelligent exercise machines, all of these sorts of things, which I think we're just really seeing the beginning of in fairly primitive form mostly, but these are going to be extremely important. As everybody knows, it's just a cliche, but it has to be mentioned, the antidote to massive formalized healthcare and healthcare costs are effective wellness systems that reduce the need for all of that. So I think there are those two dimensions. And right now, most of the investment and most of the effort has gone into the big formalized systems, but the payoff may be even much higher out of the other systems that are oriented towards autonomous, self-managed healthcare and wellness.